Xavier Becerra, Chairman of the House Democratic Caucus, joined by my colleague from New York, Joe Crowley, the Vice Chairman of the caucus. We had a extensive caucus meeting where we discussed a number of issues. First, it was good to welcome members back from a district work period where over the course of some 10 days, including, of course, Veterans Day, members had a chance to go back home, talk to their constituents. Many of them did events with our veterans. I know that the Vice Chairman and I both did so. And we also had an opportunity to discuss with them any number of issues, from finally getting the government back up and running after the Republican shutdown to how we're trying to move forward with the implementation of the Affordable Care Act. I do want to mention that over the course of those 10, 11 days, more than 1,600 events were held by Democrats throughout this country in their districts trying to reach out to their constituents back home. A quarter of those events involved Veterans Day programs and activities. Let me focus a couple of moments on what we think is very important, and that is trying to ensure that women have an opportunity to participate fully in our economy. Because as Democrats have been going around the country saying, when women succeed, America succeeds. And we are out there trying to talk about the benefits of trying to help women who are trying to get back into the workforce, or women who are trying to start their own businesses, and how that has helped so many other Americans become employed as a result of the activities of women becoming entrepreneurs. We believe that the more we go out there and talk about how it's important to give opportunity to people, and certainly women, for a number of decades were denied the full opportunity that men have had, that will be very important in getting us back on track. And so we hope that we will be joined by our fellow Americans throughout the country in making sure that when we give women a chance to succeed, we'll ensure that America succeeds as well. We heard from the White House today and the administration on the implementation of the Affordable Care Act. They gave us an update on where they stand with regard to the website and trying to take care of the bumpy launch that they engaged in with the marketplaces. We were pleased to hear that they believe that they're still on track to move forward by the end of this month in getting that website equipped to handle the large volume of Americans who are getting onto the website to inquire about plans. We know that we'll be hearing the word on the number of people who've actually gone through the website and actually enrolled. And I know in my state of California, and I believe in Mr. Crowley's state of New York, which are individual state exchanges run by our states, that the information coming out of our two states is pretty decent as well as far as the number of Americans who are finally having access to good, affordable health insurance. And we're certainly continue to engage in conversation with the administration on the issue of making sure that all Americans have a chance to hold good health insurance coverage, not junk insurance policies, not policies that deny you coverage that you thought you were going to get, not policies that have fine print that keep you from getting the coverage for your children that you were expecting, but good policies that give you protections and rights as Americans who pay for health insurance. And so we know that there are efforts underway, not just in the administration, but here in Congress, to try to make sure that every single American has an opportunity to say that he or she is holding not just good, affordable health insurance, but the best affordable health insurance possible. And that's why we want to make sure that we move forward in supporting our new health security law and making it work for all Americans. And with that, let me turn now to the Vice Chairman, Joe Crowley.
Thank you, Javier. I thought it was appropriate that we began our caucus this morning talking about women. When women succeed, America succeeds. And it doesn't only pertain to economic parity. Pleased to notice that in my own district that women are doing as good, if not better, than men in terms of earning capabilities. But that's not across the board in America. And as I said, it goes beyond earning parity. It's also about health care. And under the Affordable Care Act, women can no longer be discriminated against because they're women. That's one of the hallmarks of the Affordable Care Act and why it's so critical that we see it fully implemented. As the chairman mentioned as well, we heard from the White House, and they talked to us about their reassurance that by the end of the month, the website will be up and running fully and properly, giving the opportunity for the American public to browse as well as to purchase and to make a contract with insurance companies for affordable coverage for their health care. And so we continue, as the chairman mentioned as well, in our own districts, hearing from our constituents. I had a town hall on health care and heard very clearly from my constituents about their desire to see this law work, to see it fully implemented, so that people heretofore who have been denied the access to affordable insurance will have that opportunity for themselves and for their families. So we have passion in our caucus, the passion to see this bill fully implemented, and we look forward to that.
Questions?
I still have Mr. Becerra. Mr. Crowley, on the back hallway, they told us it was a chance to really let the White House know you've got upset constituents. What was the tone in there? Did you really let the White House people know this is not working?
We're Democrats, and we're very passionate, especially when it comes to the issue of the Affordable Care Act. You know, there have been some frustrations about the rollout, but you know, the reality is this is an enormous and complex undertaking. But it's a necessary undertaking. The system that existed prior to the Affordable Care Act denied coverage for pre-existing conditions. It discriminated against women. It did not afford affordability to millions of Americans. And that is changing now because of the Affordable Care Act. And that's what my colleagues recognize and understand. They're passionate about this bill. They also are passionate about seeing it work. And that was relayed to the White House as well.
Did they defend their position? Did the White House defend their position?
The White House has said they recognize the issues that they have faced over the last month, and as has been testified by Secretary Sebelius, as well as others before the House and the Senate, and the President himself has said that they're working towards, you know, fixing a website. As I said before, you can fix a website. You can't fix bad ideas. The Republicans are offering no alternatives and no ideas. And what the White House and what the Democratic Caucus are working towards is the full implementation of this act, because in the end, we know the American people will benefit from it.
Chairman Becerra, could I have your readout on the tone in there, too? It really seemed like it was venting and spleens what we were hearing.
No, I think Joe is absolutely correct. Members want to have this working and working as quickly as possible, because if you're like me back home, you have one of the districts with the least amount of insurance available to Americans, and we want to make sure that people have affordable health care. I constantly cite the case of a gentleman named Andrew Stryker who lives in Los Angeles, who found that he had to wait about 3 hours to get onto this website and see if he could enroll, and he finally did. And he wasn't pleased about waiting for 3 hours, but he ended up saving $6,000 in his policies for the coming year. That's what we want to see, is that people are saving a lot of money and getting better coverage than they had before. But you have to make sure that the process works well for everyone, because you don't want them to get frustrated by the process. And so we appreciate that the White House is working hard on that. And it should surprise no one that Democrats are going to be very animated to make sure that this process works well so Americans can get covered. That's what people want. Take advantage of this health security law to get covered and have the security of knowing you'll never go bankrupt simply because your child had to go to the hospital.
Will you be whipping against the Upton bill?
I'd have to approach the whip on that, but I know a number of members made it very clear that the Upton bill doesn't do anything to fix any of the concerns that have been raised by Americans. In fact, it does the opposite. It harms the ability for Andrew Stryker and other people in America to gain affordable health insurance coverage. And so we're interested in working on anything that, as the President said, improves the health security law, but we're not interested in, once again, for the 46th time, repealing all or part of the health security law that gives Americans the ability to know that they'll be able to go to a doctor or a hospital when they need to.
Does the administration have to announce something?
Okay, I just want to follow up. The Upton bill is just another attempt to undermine the Affordable Care Act. That's it. It's plain and simple. And when my colleagues on our side understand that, I believe they'll vote against it. I don't intend to support the Upton bill. I don't believe Mr. Becerra intends to do that as well. And we're communicating with our colleagues as well about that.
Does the White House have to announce something this week before the vote on an administrative fix to the canceled policies? And is there any legislation that your leadership is putting together?
So let's be clear on these canceled or converted policies. There is nothing in the Affordable Care Act that is requiring these policies to be canceled. that insurance companies are canceling health insurance policies that Americans may hold today is the decision of those insurance companies. Now, some of those insurance companies may say, well, we can't continue to offer the same policy starting next year. And in the case of some Americans, that's correct. But what the insurance company is not disclosing to the American people is that when the insurance companies offered Americans those insurance policies, they knew full well, the insurance companies knew full well that those insurance policies that they were putting out there for Americans to consider could only last until the end of 2013, part of 2014. And so it's important for the insurance companies to not mislead the American people into believing that if they are canceling an insurance policy that American has, it's because of the Affordable Care Act. It's because the insurance companies chose either not to continue that policy, or because when they enrolled that American into that insurance policy after 2010, they failed to inform those Americans that that policy would have to change to provide more security for Americans. And so I think that's important. What the president has said and what the administration representatives said here today is that it doesn't make any difference if the insurance companies are doing something. And by the way, a lot of insurance companies are doing the right thing. Some of these insurance companies are scaring Americans. But as the president said, it doesn't make any difference if the insurance companies are scaring Americans, or if Americans are simply confused, or if they're just frustrated because they can't get the right information because it's been tough to get on the website. Either way, the president has said, and I believe Democrats agree, that we have to make sure that any unanswered question is answered, any concern is addressed, and any problem is addressed. And so I think the president is intent on making sure that to the degree that there is something that needs to be done to the website, to make the Affordable Care Act work as well as possible, he will do it. And I think you're going to find the Democrats who want to make sure Americans have affordable health care will continue to do whatever possible to work with the president to improve on the health security law that Americans now have.
Congressman Crowley, you were suggesting that, once members of your caucus understand, in your words, that the Upton bill is just the 46th attempt to undermine the Affordable Care Act, that they would vote no. Do you think there has to be a lot of education of members between now and Friday to get them to vote no? It seems like many of them are mulling over voting yes.
I think members of our caucus continue to ask questions. There were questions asked this morning. I think throughout the week that'll be the case as well. And I think in working with the White House and finding solutions to address the issues, and at the same time not go back and support a bill that will in some way repeal in whole or in part the Affordable Care Act. My colleagues also recognize the sacrifices that have been made by our caucus in the passage of this law, and they're committed to seeing this bill through, the Affordable Care Act, as I've mentioned. We all are. And it's in the interest of our country to see this through. In the end, we're going to continue to see the price of health insurance come down. We're going to see more people have the opportunity to afford insurance. And in the end, the American people will benefit from this bill.
Can you elaborate on what you mean by the sacrifices that
What I'm suggesting is the Democrats in our caucus were responsible for the passage of this bill when it was enacted in 2010. And we know, and took a great deal of heat for it, but understanding in the end what we were doing was in the best interest of our country, in helping to reduce the cost of medical insurance and to spread the opportunity for the affordability of that.
Let me just close by saying this. I don't think the American people care what the discussion or debate is in the abstract. They just want to know that the program works. When Andrew Stryker finally got through on the website and found out that he could save $6,000, he wants to now know he's going to save $6,000. So I think all of us are going to work very hard to make sure that Andrew Stryker and a lot of other Americans get to save money when they finally get affordable health care that really gives them real coverage and doesn't lapse at the wrong moment or tell them, oops, we forgot to tell you that that's not covered when you went to the hospital. We want folks to understand that it should be history now when any American says, guess what, I'm going to have to file for bankruptcy because I had to take my son to the doctor and ultimately to the hospital. That should be history, and that's what we're here to do. And so we're going to do everything possible to work with the president and with our colleagues, both Democratic and Republican, to make sure we improve our ability to offer Americans quality, affordable health care that they can count on and will protect them. Thank you very much.